Hello, Boone County. This is your Superintendent, Matt Turner. I'm here with Amy Schroeder. She's our school nurse at Ackerman Middle School, and we're here to ask her a few questions about student health. So, Amy, thank you very much. Appreciate your time.
Thanks for having me.
So, let's talk a little bit about student health. So, what do parents need to know? What if their child is not feeling well before school?
So if your child's not feeling well, we recommend you take their temperature, see if they have any symptoms. If they have a fever above 100.4, we ask that you keep them at home. The exclusion guidelines for Boone County Schools is that a fever of 100.4 stays home and they need to be fever-free for 24 hours without fever-reducing medication. If your child's vomiting, you want to keep them at home too. It's twice within 24 hours. You want to keep them home. Sometimes kids wake up with sick bellies from anxiety, nervousness. It's okay to send your kids to school. Our schools are provided with great nurses and health clerks in our buildings that can, do some assessments and see if things need to be sent home or what needs to go on there.
Okay, and what you're talking about, that process, that doesn't matter whether a student has a really bad cold or a sinus infection or a COVID case. Essentially, if they have symptoms, they need to be staying home.
Right. They need to stay home, contact their doctor, and kind of get your doctor's advice on what you need to do. But definitely, if you're not feeling well, then just stay home.
Yeah, but those symptoms need to be just what you described earlier, about the temperature at a certain level, those types of things.
Correct.
Okay.
Correct.
Amy, we have a school nurse assigned to all of our schools. What's the process if a child is sick at school?
So when a student comes into the first aid room, the health clerk or the nurse will kind of assess that. We ask a lot of questions. Did you eat breakfast? What's going on? And we kind of do an assessment there. A lot of times we'll send the kids back to class if it's not something that's a fever or vomiting. Sometimes we ask a few more questions. And then there are times when we will call home and just tell the parent, hey, we've got so-and-so in the first aid room. What are your thoughts? They said they told you this morning they weren't feeling well. Kind of get a little parent involvement. Obviously, we can't call for every kid. It's not uncommon for a first aid room to have anywhere from 30 to 100 visits a day with the students. So we can't necessarily call on all of them. But if we do call, it's okay for parents to say, just let them stick it out at school. We're really trying to encourage students to stay in school so that parents can go to work. And but if your student does have a fever of above 100.4, or if they are vomiting, we will ask that you come get them, and we would hope that within 30 minutes to an hour that the parent could get there. It's also good to have emergency contacts on backup so that if you have to send somebody else to get the student, that they're on file, that they could be able to pick your student up.
Amy, talk about the partnership that we have with St. Elizabeth for telehealth, where they have a process where a doctor may be able to have an appointment online, and we might be able to get the parent involved in that process. Kind of walk through that so everyone understands how that works.
So we are partnering with St. Elizabeth to do a telehealth. It is not replacing the child's physician. It's working with the child's physician. So kind of what that does is we call a parent. And if it's a telehealth visit that we can do, we get permission from the parent. St. Elizabeth will contact the parent. The parent can be part of that visit with the practitioner. That's all via a link that they send the parent. The parent can be involved, and then they can follow up. They send all of those results, whatever is decided on that visit, to the child's physician. Boone County does not get any money from that. St. Elizabeth works with the parent's insurance, and St. Elizabeth takes care of all that. We're just the facilitators to be able for a practitioner to see this child. And we're really trying to reduce next day absences if at all possible, and getting these kids seen. They can call in prescriptions for these kids, so it also helps with parents not missing work, not having to stay home with their children, if we can help facilitate that.
Great, and that's a completely optional process. So
it
only
is
if a parent really
completely
wanted
optional.
To do that.
Absolutely.
All right, thank you.
Absolutely.
Amy, what happens if my child has a health condition that needs to be monitored at school?
So we have healthcare plans for, our main ones are asthma, allergies, seizures, and diabetes, but we have individualized healthcare plans that we can sit down with the parent and go over. We follow doctor's orders on all of our things at school. So there's med consents, there's forms in there that the information goes to transportation so that we can keep these kids safe on the bus to and from school. If they need to have emergency medication at school, we can do that. So, with the healthcare plans, it's good to call the school, have a meeting with your nurse, find out what all you need to get filled out in order to have those medications at school for your child.
All right, thank you. Let's talk a little bit about the requirements for school entry that we have for kindergarten, for sixth grade, and for high school.
Okay. So for kindergarten, an immunization certificate is required for school entry. We need to have that on a Kentucky certificate. Some of the nurses have been given the availability to put those if they are able to do that with the timing purposes. The Northern Kentucky Health Department also does that. A school physical is required within the first 30 days for kindergarten, and then a vision exam and a dental exam is required within the first 5 months. You have until January to get those. And then for sixth grade, that's typically when they turn 11 that they'll need their sixth grade shots, the Tdap and the meningococcal, so we'll need an updated immunization certificate, as well as a preventative health care exam, which is a physical, not the same as a sports physical. They can be on the same visit, just a different paperwork. And then when your child turns 16, they're required to get their second meningococcal vaccine, which is typically when another updated immunization certificate is due.
Right. Talk a little bit about vision screenings that happen within our schools.
So we partner with the Florence Lions Club, and we do vision screenings every year in the fall on second grade, fourth grade, sixth grade, and eighth grade. And we do vision screenings just to give us a baseline of where these kids are. If they come back that they need further evaluation, the nurse will contact you, the parent, to then get a vision exam. If an exam is something that's not covered with your insurance, the Florence Lions Club works well with us to try to help parents get glasses, get appointments, and those types of things. So it's nice to be able to partner with them.
Talk about the relationship our nurses have with the clinicians in the schools.
99% of our schools have clinicians, but we work hand in hand. My clinician at my school is my right-hand man. She helps me do everything that I need her to do. Really, there's not much she can't do other than listen to lung sounds and take a manual blood pressure, but we kind of get a good partnership. I've worked at other schools with other clinicians, and it just kind of depends on what you feel comfortable and how your clinician works with you, as what your assignments are and how you divvy up those assignments. But without my clinician, I would not be able to do my job as effectively and take care of the kids as well without her help. Most of the kids in the school, and even I as a parent before I became a nurse in the district, thought the clinician was a nurse because we work so closely hand in hand doing the job and making sure that the kids are taken care of.
Amy, if our parents call into the school and they get the clinician or they get to the nurse, is there a really big difference? Does it matter which person they're talking to if it's in regards to the health of their child?
No, it doesn't. In our building, it's just whoever's the first available. If I'm available, they'll send it to me as the nurse. But if I'm with a student or with a parent, we don't keep that parent on hold. They can talk to the clinician. And my clinician's good. If she doesn't have the answer, she says, let me ask the nurse, and the nurse can call you back. So, they can call in and talk because, like I said, we work hand in hand on the kids' information. So.
All right, great. So last question I have for you. You have a challenging job, but a very rewarding job, I know.
Yes.
What do you love most about your job as a school nurse?
I love the kids. It's great to see them come in. It's great to see them grow up. We have them 6th, 7th, and 8th grade, and what they came in 6th grade versus 8th grade. Some of these kids just come in and need a hug. They just need some attention. And that's really my favorite part of this job, is just seeing the kids, being able to help them, being one positive person among many in the school system. So the kids are why I do what I do.
That's fantastic, and yeah, you're absolutely right. Everybody's an educator when they're inside of a school because kids look up to the adults in so many different ways. That's great that you mentioned that. As the last word here in my conversation with Amy Schroeder, one of our school nurses, I want to be sure that I thank all of our school nurses and all of our school clinicians for the last 2 years. Working through this COVID pandemic has been extremely challenging for everyone, but our nurses and our clinicians have gone way above the call to duty. They have really served our schools, served our students, served our communities so well, and I'm very thankful for all the work that they've done over these last 2 years. Thank you. Hopefully this has been a helpful session for you to learn a little bit more about the work that goes inside our schools with our school nurses. Thank you very much.